Speaker, I seek unanimous consent to bring forward a motion requiring the government to implement paid sick days legislation to help protect workers across Ontario from COVID-19 so no one has to make the difficult choice between staying home when sick and being able to pay the bills.
Leader of the Opposition is seeking unanimous consent of the House to bring forward a motion requiring the government to implement paid sick days legislation. Agreed? Agreed. Heard a no.
Point of order.
Point of order. Leader of the Opposition.
Thank you, Speaker. Speaker, I seek unanimous consent to bring forward a motion without notice calling on the Ford government to revoke Regulation 298/21 and the unprecedented and potentially unconstitutional powers it has extended to Ontario's police services.
Leader of the Opposition is seeking the unanimous consent of the House to bring forward a motion without notice calling on the government to revoke Regulation 298/21. Agreed? Agreed. Heard a no.
Point of order.
Leader of the Opposition.
Thank you, Speaker. Speaker, I seek unanimous consent to move a motion without notice calling on the Ford government to implement paid time off for vaccinations, helping facilitate the timely vaccination of Ontario's workers as part of the fight against COVID-19.
Leader of the Opposition is seeking unanimous consent of the House to move a motion without notice calling on the government to implement paid time off for vaccination. Agreed? Agreed. Heard a no.
Point of order.
Leader of the Opposition.
Thank you, Speaker. I seek unanimous consent to move a motion without notice calling on the Ford government to implement a full shutdown of Ontario's non-essential businesses where the risk of COVID-19 spread is high and extend adequate financial supports to help the workers and businesses impacted by the interruption.
The Opposition is seeking unanimous consent of the House to move a motion without notice calling on the government to implement a full shutdown of Ontario's non-essential businesses where the risk of COVID spread is high. Agreed? Agreed. Heard a no.
Point of order, Speaker.
Leader of the Opposition.
Thank you, Speaker. Speaker, I seek unanimous consent to immediately pass Private Member's Motion 136, calling on the Ford government to provide financial assistance for small businesses not eligible for other supports during the pandemic.
Leader of the Opposition is seeking unanimous consent of the House to immediately pass Private Member's Motion 136, calling on the government to provide financial assistance for small businesses not eligible for other supports during the pandemic. Agreed? Agreed. Heard a no. Point of order, the member for Scarborough-Guildwood.
Thank you, Speaker. Speaker, I seek unanimous consent to move a motion regarding the immediate passage of Bill 247, the Paid Personal Emergency Now Act.
Member for Scarborough-Guildwood is seeking unanimous consent of the House to move a motion to provide for the immediate passage of Bill 247. Agreed? No. Heard a no. I understand the Government House Leader has a point of order.
Thank you, Speaker. Speaker, I seek unanimous consent to immediately pass the motion tabled this morning by the member for Eglinton Lawrence respecting the establishment of a Holocaust Memorial.
Government House Leader is seeking the unanimous consent of the House to move a motion without notice with respect to the immediate passage of a private member's bill regarding the Holocaust. Well, send it over then. Thank you. Government House Leader is seeking unanimous consent of the House. The Legislative Assembly should, in broad consultation and direct engagement with Ontario's Jewish community, establish a Holocaust memorial on the grounds of the Assembly. Agreed? Agreed. Agreed.
Thank you, Speaker. I seek unanimous consent that the House continue to meet today past 6 p.m.
I think I can manage that one. Government House Leader is seeking the unanimous consent of the House to allow the House to continue to meet today past 6 p.m. Agreed? No. Heard a no. It appears we're done with the points of order. So now we have question period, and I recognize the Leader of Her Majesty's Loyal Opposition.
Thank you, Speaker. Speaker, my first question this morning is for the Premier. Speaker, COVID-19 is tearing through our communities. At this point, almost 750 people are in ICUs, literally struggling to breathe. On Friday, the Premier decided not to take the advice of the medical experts that asked him to deal with this horrifying situation in our province. He chose not to. Will he instead do that today?
Minister of Health.
Thank you very much, Speaker. Well, in fact, we have been taking the advice of the medical experts since this pandemic began. We have been taking their advice with respect to the need to maintain physical distancing, to follow the public health rules, to the declaration of the state of emergency, most recently in the stay-at-home order. We also followed the advice that was given to us that we needed to step down on scheduled surgeries, which we did. We followed the advice with respect to rolling out and redeploying health human resources from one location to another to make sure that in hotspots we had adequate people to care for those in intensive care. And we also followed their advice in order to be able to move patients around if necessary from one location to another, to deploy all of our health workforce and our health availability in intensive care and other units across the province. So in that, in everything else, we have followed the health experts every step along the way during this pandemic.
Supplementary question.
Well, Speaker, the Minister of Health knows that that is not the case. In fact, members of the science table, every single member of the science table disagrees with the statement that this minister just made. Speaker, frontline staff were literally sobbing in hallways of hospitals when they saw the Ford government's press conference on Friday. Experts have been pleading with this government to protect vulnerable workers. The Premier instead decided to close playgrounds and give police sweeping powers that they didn't want and that they won't use. Speaker, the government's expert advice from the science table has been very, very clear. Why will the Ford government not take the advice of the experts? Why will they not?
Question.
And will they finally do so today and help save lives of Ontarians?
Minister of Health.
Thank you, Speaker. In fact, our government has taken the advice of the Health Science Advisory Table, the Public Health Measures Table, Dr. Williams, our Chief Medical Officer of Health, the medical health officers in each of the 34 public health unit regions. That is why we decided to deploy 25% of all of the vaccines off the top before they're delivered to the 34 public health unit regions in order to dedicate those extra vaccines to the hotspot areas. We know that's where a lot of the transmission is happening, and if we're able to do that, we will be able to get the numbers more under control, to reduce the number of people in ICU, to save more lives. That is the goal of all of this. That's what we're following. That's what the medical health officers recommended, and that's what we're doing.
Final supplementary.
The experts were very clear what we need in Ontario to save lives and save the health of our people. Paid sick days, not carding. Essential workers being vaccinated, not being stopped for checks. Shutting down of workplaces where COVID-19 is spreading. Not shutting down playgrounds, Speaker, playgrounds and soccer fields. The advice was very, very clear. I think that we need to hear from the Premier in this government exactly whose advice are they taking, because they clearly are not taking the advice of the experts. Will this Premier finally start listening to those frontline healthcare workers and the experts who are pleading with him to do the right thing?
Minister of Health.
Thank you, Speaker. And in fact, what the Chief Medical Officer of Health has recommended, what the Science Advisory Table has recommended, is that we need to have enhanced public health measures because this is spreading within our communities. We need to stop that. That's why the recommendation was made with respect to the closure of playgrounds, because of close community interaction. However, We did hear from people that this was not something they wanted. We are listening. That is why we made that change. But we are still asking people to please follow those public health measures. That is how this transmission is happening. That is what the medical experts have told us. And that is also why we're deploying 25% of the vaccines off the top to go into those health hotspot areas, because we know if we can deal with those hotspot areas, that is going to be good for the entire province, because that will reduce transmission and make our hospitals be able to cope with the numbers of people that are coming in and reduce the number of people that we have in intensive care units. That is all part of the advice that we've received, and that is what we are following.
The next question, once again, the Leader of the Opposition.
Speaker, my next question is also for the Premier. Nobody agrees with the Premier. Nobody agrees with the Premier. The Science Table has publicly asked for a correction of course, a course correction. That's what the Science Table is saying, not what the minister is suggesting. The police publicly rebuked this government on the regulation they brought forward on Friday. Even the PC caucus seems to be in revolt when it comes to the decisions their own government is making. We need to fix this scenario. The government can do that. We need to prioritize the saving of lives, the health and well-being of Ontarians, the saving of our hospitals and our healthcare system. Will the government do the right thing? Reverse course and actually implement the measures that the experts have been telling him are necessary to save Ontarians' lives.
Minister of Health.
Thank you, Speaker. Well, our government has been following the recommendations made by the Medical Officer of Health, the Science Advisory Table, and others. Our goal is to save the lives of the people of Ontario, to protect their health and well-being. That is why we've taken the steps that we've had. And we understand that there's a lot of transmission in the community, that we need to limit mobility as much as possible for the next few weeks. This is a very, very difficult state that we're in. We recognize that. And we know that we need to roll out those vaccines as quickly as possible. That's why they're available in vaccination hotspots. They're available in private clinics. They're available in pharmacies. What we need is a greater supply so that we can get more needles into more arms as fast as possible. That is what we're doing. We are working with the federal government, and we know that we need to move fast on this and to reduce transmission. We've followed this advice from the Chief Medical Officer of Health all along. With respect to the Science Advisory Table, I know there's an issue with respect to some of the items that they are concerned about. I will deal with that in my supplemental.
Thank you. The supplementary question.
Speaker, the very Science Advisory Table that this minister claims that the Premier is following the advice of said we cannot vaccinate ourselves out of this crisis. That's what they said. They said that weeks ago, but the government didn't listen. Doctors, including the government's own experts, feel betrayed and they feel frightened. Dr. Peter Uni says this: yesterday, referring to Friday, was one of the darkest days in my professional career and also personally. It's just wrong, you know? It's just wrong. Dr. Ashley Chute said, I quote, "I feel sick. I actually feel sick. If they don't get this now, they're not going to get it. It's been a few hours, but I am still shaking." Speaker, lives are at stake in our province. People are dying of COVID-19. Will the Premier finally admit that the measures he announced Friday were the wrong measures and actually take the advice of the experts and implement measures that will save lives and get us out of this horror show that we're all living?
Minister of Health.
Thank you. We have been following the recommendations made by the Science Advisory Table all along. I understand that Dr. Uni is concerned that not all of the public health regions that they recommended were included in the list that we projected. However, it's really important to understand that that is not the only thing that one needs to look at in identifying the hotspots. We looked at what the recommendations made by the Science Advisory Table, but we also need to look at hospitalizations, outbreak data, low testing rates, and and deaths during the second wave of the pandemic. We also need to look at some of the socioeconomic barriers that are preventing people from coming in to receive the vaccines. All of those were taken into account in identifying the hotspots across this province. All of those were taken into account with the best interests of the health and well-being of the people of Ontario. We started with that at the beginning of this pandemic. It continues to be our main focus, and it will be throughout our response to it.
This is the final supplementary.
Speaker, lives are at stake. Lives are being lost. People are struggling to breathe in the ICUs, which are bursting at the seams with COVID-19 patients. Dr. Andrew Morris says this, and I quote, 18 months ago, we talked about hallway medicine. Now we're talking about hallway deaths and tent deaths. We need a government that will listen to science. The Premier has to start listening to the pleas of the frontline ICU doctors and nurses, not to the anti-shutdown, anti-science wing of the PC caucus. Will he start doing that?
Minister of Health.
Thank you, Speaker. We have been listening to the recommendations made to us by the medical experts, by the epidemiologists. That has been the case every step along the way. And what we've been trying to do, in addition to reduce transmission, is build capacity in our ICUs. We started that a year ago. We've built over 3,400 beds in our system, which is the size of 6 community hospitals that have started. We've added over 285 intensive care beds. What we're doing now is making sure that we can use our entire health capacity to make sure that we can use every single bed that we need to use. That is why we're transferring patients, if we have to, from one location to another as close as possible to their home location. That is why we're redeploying staff from all across the province. We are working with other provinces to assist some of their assistance as well, and that is why, unfortunately, we've had to postpone slightly the scheduled surgeries and procedures so that we will have the people in the hospital to care for the COVID patients who would otherwise be caring for the surgical patients. All of that is on the basis of medical advice that we're receiving on a daily basis.
And the next question, Leader of the Opposition.
Speaker, my next question is also to the Premier. The Premier had a whole year to plan to avoid the crisis that we're in. And instead, what he's ended up doing now is having to deal with a scramble, begging Conservative premiers around the province for help that they can't provide, rejecting help from the Red Cross, unbelievably rejecting help from the Red Cross when it was offered last week. He is putting petty politics ahead of human life, and it's a disgrace. There's a nightmare scenario happening right now in ICUs, almost 750 patients in ICUs in our province. How can the Premier possibly justify rejecting any offer of help when Ontarians' lives are at stake?
Minister of Health.
Thank you, Speaker. Well, we have taken every step possible and are continuing to do so to build capacity in our healthcare system and our intensive care system. It's one thing to have the beds. It's another thing to have the health human resources to be able to operate them. In some part, we will already have the health human resources because they are already there. They would otherwise be dealing with surgical patients. We have to postpone that somewhat. We'll get back to that as soon as we can. We know we have that internally, but we're also looking at Ontario Health, at the former LHINs. We're looking at making sure that we can bring in more students, student extern program that we already have. We had 900 spots filled as of February. We can extend that to 3,200 people with pharmacy technicians and other technicians. We are building that capacity to be able to deal with this. But as a Leader of the Opposition should probably be aware, this is not just happening in Ontario. This is happening across Canada and around the world because of the variants. This is a new situation that we're dealing with now. They're very, very transmissible. That's why it's so important. We are asking people to please follow those public health measures.
Thank you. The final supplementary.
Speaker, the Premier of this province needs to stop the political posturing. He has to stop. People are dying of COVID-19 by the thousands.
Order.
What we need in our province is paid sick days, not carding. What we need is giving essential workers the vaccinations that they need, not giving them spot checks on the side of the road. What we need is to shut down workplaces where COVID-19 is spreading, not shut down playgrounds and soccer fields. We have to start putting human life. The Premier needs to start putting human life above his political pride. So my question is, can this Premier actually do that?
Mr. Bell.
Thank you, Speaker. Well, protecting human life has been our primary goal since this entire pandemic began, and I can assure the Leader of the Official Opposition, through you, Speaker, that that is the Premier's primary goal right now. He has been working day and night trying to get assistance for Ontario right now. He is working very, very hard. He's working with other premiers. We're looking at other countries to try and get assistance to make sure that we have health human resources, in part to relieve the people that we know who are already in the front lines are working day and night to save lives. That is
Leader of the Opposition, come to order.
That is what we're working on. And in terms of what we're doing to protect human life, we are dedicating 25% of all vaccines that come in to go into those hotspots, to go into those factories, to go into those workplaces, to make sure that we can vaccinate people who are living in some of those hotspots. That is the plan. That is what we're going to do, and that is what's going to save lives.
The next question.